Hi, okay, so today we are doing blood smears today. I have some blood collected from my patient Muffin Vargas, who's a canine. Today we are going to demonstrate how to properly do a wedge smear technique for a blood smear. I want to show you that I have my slider slide, and I have two separate slides here. I want to do two samples just in case one of the samples, something happens, I have an extra sample on hand. I also have it labeled with Muffin Vargas's name as well as today's date. And there are absolutely clean slides. So you want to make sure there's no fingerprints, no artifacts, nothing that's going to get on these slides. This is a clean table, no dust. So we should be good. I also have my blood collected here in EDTA, which is the preferred method for blood smears, blood collected in EDTA, or you can use whole blood. Placement of the blood can be done with a hematocrit tube here, or with a 1 ml syringe, and you'll see the difference in what each yields for your slide. So we'll go ahead and start with the 1 ml syringe here. Go ahead and collect our sample. I'm going to go ahead and place a single drop right at the top of the slide, about like that. And then for the hematocrit, you can also go ahead and collect some blood right from your source here, and then you can go ahead and tap that on there just like that. But you see how little comes out compared to your 1 ml dropper? So this will only yield a very small smear. Give it a good amount there, so it gives me a good smear so I can check for morphology of the cells. Next part, so this is the wedge smear. So what we're going to do is we're going to go ahead and bring our slider slide here, and we're going to bring it in a 30-degree angle, and this is if we're not suspecting anemia or if we're not suspecting dehydration, the angle of your slider is going to vary. So in this case, we're going to go ahead and do the normal 30-degree angle. So we're going to start at the top, and we're going to bring our slide back, meet it with a drop of blood, let it spread across the surface, and then gently you're going to slide forward. Your smear should cover 2/3 of your slide, so you want a good amount here. For your hematocrit one, same thing. We're going to go ahead and bring it back, let it spread, and slide. So you can see the difference of the two slides. There's very little yield here, very large yield here with your 1 ml dropper. All right, so the next step is to go ahead and we're going to stain these slides once they're air dried. We like to stain them with Right Stain or with Romanowski Stain. In other words, this is just the Diff Quick. You're going to start with the 3 different stains, and you're going to be inserting them about 5 times each, or about 5 seconds each, and I'll show you that in just a moment. These are air drying right now. I actually already have a prepared sample that has been air drying for Muffin Vargas. This is ready to go. As you can see, I have a nice body. I have a nice feathered edge out on the outside, and then I have my counting zone, which is going to be right in the middle here. So again, the body, the counting edge here, and then your feathered edge out on the outside here. All of which that can describe different types of morphologies and indications for the cells. So go ahead, we're going to bring this right over here to our staining station. We'll walk right over. Okay, so we have our stains here. We have the blue, the red, and the purple for easy speak. So we're going to go ahead and open this up here. And we have our slide. And we're going to go ahead and dip 1, 2, 3, 4, 5. Give it a little tap. And to the next one. 1, 2, 3, 4, 5. Give it a tap. And to the next. 1, 2, 3, 4, and 5. Give it a little tap, and then I'm going to grab some distilled water here. And we're going to rinse the back side of the film, not the front where my thumb is holding, because that's where my sample is. We're going to rinse the back. So we're going to bring this over to the trash. We're going to rinse off that back side. give it a little tap. And then we're going to come over to our drying paper here, the Bibulus paper. Find a clean spot, and we're going to go ahead and place that there and let that dry. We're going to lift up, let that dry. Being careful not to scratch the surface because we don't want to add any more artifacts, so we're being very careful not to scratch that surface or to allow this to sit out for flies to kind of collect blood, because flies are nasty and they like to come and eat the blood right off. So here we are, we have our dried sample. And so let me put this up here next to the white paper towel here so you can kind of see the different hues of reds, the purples, the blues that are all going to show you different morphologies of the cells. You can see again here your body. This is where your counting zone is going to be right about here, and then your feathered edge out on the outside. Now for inspection, when doing a differential or doing a examination of this blood, we're going to use the Immersion Oil, and we're going to place a drop right where our feathered edge is. However, beyond the scope of this video, when placing your slide, here on your microscope, first thing you usually want to do is to scan the areas and look for that monolayer, or where cells are not overlapping quite so much but are kind of uniformly touching each other. Once you find that area, so you'll have your slide here, once you find that area with your high dry or your 40 times, then you'll go ahead and kind of slide your microscope over. That way you can come in and add a little drop exactly where the light is, so you know exactly where you're going to be starting your count and or looking at your examination. Once your drop is on there, you can go ahead and move it over to your 100 time or your oil power here, and then you'll be able to examine your blood smear. Going on to the blood smear and differentials, again beyond the scope of this video, but you'll be going up and down kind of in a plowing pattern, so a battlement pattern. So you're going to go up, across the slide, back down the slide, you're going to look this way and go back up, and that is how you're going to be viewing the slide. Blood smear.